Dr. Harris, a very good evening to you. Thank you for being with us. So at the latest briefing today, Dr. Tedros spoke about how you've accelerated research and development on COVID-19. How far then does that move us in the goal of flattening the global COVID-19 curve?
Well, let's separate things out. So to flatten the curve, we really need to do several things. One is test wherever possible, test, to identify where the virus is in your community, in every community. And we've got it in large volumes in many, many communities. But you still have to find out where it is. You find out who the people are who are ill, who the people are who are likely to become ill. That's the people who've been in contact with those who are infected. And you separate those people from the healthy. So if you can do that, if you can keep the people who are ill and potentially ill properly self-isolated, then you can stop the virus from transmitting, because it's got to jump from person to person. It's got to stay in our bodies in order to reproduce. It jumps into our cells and it uses our cells as a factory to make more of itself. So if we can stop that, we can stop the virus.
And I want to put to you the numbers that we're getting here in South Africa tonight. We've got 1,845 people who've now tested positive for COVID-19. The number of deaths rising to 18 tonight, and 63,776 tests have been conducted. When you look at those figures and you look at the 21-day lockdown, which is due to come to an end next week, would you say that South Africa would be best advised to extend the lockdown while testing and all the other measures continue?
Certainly, lockdowns give you some time and space. And so what those figures are telling me is that you're still relatively early in your outbreak and you still have the time. You've got the time to flatten that curve. You've got the time to find the virus. You've got the time to put in the measures, the social distancing measures. That's get everybody genuinely not crowded together. Now, that doesn't mean you have to stop society, but it does mean you have to look at how do you limit the opportunities for people to be packed together and really, really crowded, and how do you ensure that everybody has the opportunity to keep their hands pristine? How do you ensure that people are not exposing one another? So again, that's what I mentioned before, the testing and finding all the people who are potentially infected and ensuring that they self-isolate.
And a lockdown then would be crucial to making sure that we keep these numbers as relatively low as possible.
So a lockdown is what many societies have found is for them the most functional strategy, because that's kind of quarantining all of society. But ideally you want to target where the virus is. You want to target the people who are at risk of transmitting the virus or having it transmitted to them. Because if you can do that well, if you can really find where your virus is, and if you can really stop it transmitting, then you can move back to a more normal society.
I want to talk to you about the picture in Europe, Dr. Harris, because Italy, France, Spain, the UK have all been reporting deaths from COVID-19 by the hundreds. We are hearing positive patterns in other parts of Europe, in those countries where they're seeing a slower rate of infection and fewer deaths. Is the worst over for most of Europe?
There are many different outbreaks going on in Europe. So we are seeing some very positive and welcome signs in Italy, where they've managed to flatten their curve. Their numbers aren't coming down very slowly, but they've stopped rising. And that is really, really important, because as the numbers slow, that gives the healthcare workers and the hospitals time to treat those people who get the severe form. Because I'm sure, as you know, when you get the severe form, that requires at least 3 to 6 weeks in intensive care. So if you have too many people who are ill with that, there just isn't space. There isn't an opportunity to treat them. And that's when you get a big rise in deaths, because you simply cannot cope with the number of people who need your help.
And we've seen then today, with the lockdown having ended in Wuhan, China, where the first cases of coronavirus were reported in December of 2019, people going out in very large numbers back on the streets, some beginning to travel. Would it be correct for me to suggest that perhaps a return to the streets and other busy parts of the country there is not the best way at this stage to handle it, given that there is likely to be a secondary round of infections from this coronavirus?
So for this year, we really have to look at how we behave and how we can behave differently to limit the exposure. Now, I think the Chinese have certainly had a very intense experience with this and are taking it as carefully and slowly as possible. It wasn't simply the lockdown that helped them get those case numbers down. They tested intensively and they followed up every case and they ensured that everybody who was exposed was followed. Sometimes, they would follow people with their phones, and they've got these little QPRs that tell you whether you're a contact or you're not a contact, whether you're allowed to move or not. So they're using a lot of technology as well to try to help their society find a way to return to some kind of normal. But I think what we all need to understand is there will be new normals.
The WHO...
Having said that, I think Africa... Oh, sorry.
No, finish your point about Africa, Dr. Harris.
I was going to say, having said that, Africa has got one advantage. Many countries in Africa are very used to outbreaks and do understand the importance of surveillance, and do understand that you have to go into quarantine. So while the rest of the world was taken by surprise, my feeling, and the feeling of many of my colleagues, is Africa is better placed in many ways. There are lots of problems like the need to hand wash and the number of people who are malnourished, the people who have other illnesses. But in terms of understanding what it takes to end an outbreak, many countries in Africa really understand this very well.
Very quickly then, Dr. Harris, you've also been criticized by the US President Donald Trump as the WHO, accusing the organization of being very Chinese or China-centric in its understanding of this outbreak. What is your reaction to that, firstly, and what are the areas where you as a WHO think, looking back now from the origins of the outbreak, you could have done better?
So I think I'll just quote my Director General, who said this afternoon, quarantine politicization of this virus, that the squabbles, the carrying on between nations, the comparison between nations, that doesn't belong in a response against a virus of this lethality, this severity. This is a threat to humankind, and this is where we all stand together. And he put it very clearly. He said, if you're going to keep on playing political games and politicizing this, then you're going to see more body bags. It is time to stop this so that we all work together to stop this virus, not fight each other.
Dr. Margaret Harris, spokesperson for the World Health Organization, Skyping with us from Geneva. Thank you so much for your time.